I'd like to introduce pharmacist Victor Falah from the United States. Welcome, Victor.
Thank you.
Could you tell me when you first heard about LDN?
Well, the first time I heard it is I was in my pharmacy and a patient walked in with a prescription from Dr. Bernard Bihari for the LDN. And I haven't seen it before, so I called Dr. Bihari and he explained to me that it has to be compounded. And since then, we started compounding the LDN.
And when was this? Can you remember?
1994.
And how many people would you say you're filling prescriptions for now?
We do like probably over 100 patients a week.
Goodness.
I'm talking 100 new patients.
100 new patients
New
a week?
patient.
Wow. That is very impressive, isn't it?
Yes.
And what would you say the feedback is from these people that are taking LDN?
Well, the majority of it are really very happy. I mean, not everybody is using it for the same purpose. When we started compounding it for people with HIV, and that's how we started it. And then after that, it turns to be good for multiple sclerosis, and most of our patients right now really have multiple sclerosis. People with MS are very happy with it. Now, some other people using it for other purposes, and they're also happy with it. Our success rate, I would say probably 70-75%. And the reason I say that, because people keep refilling their prescription. Usually you do not refill something if you're not feeling better or you're not seeing any results.
What kind of conditions other than MS would you say your patients have?
Well, we have a good amount of HIV. We have Crohn's disease. We have some autism. We have some arthritis patient also. Like anything has to do with autoimmune system, we have some patients. But most of our patients have multiple sclerosis. That's the majority.
For the autism patients, what is the feedback that you're receiving from them?
Well, the autism, it's doing okay, not as good as MS. Some of them, they use the cream also. They do not use the capsules. So the autism, the majority of the patients, they use the cream. Their success rate is really probably 40%, I would say. 35 to 40%. And that's like approximate. It's not like really accurate, but that's approximate.
What do you say to people that contact you to ask what your opinion of LDN is?
Well, I just tell them my honest opinion. I really think it works. It works very well. I believed in it from the beginning. I saw the result with my own eyes.
And what sort of side effects, in your experience, could people possibly have initially?
Well, most of the side effects are really like stomach side effects, and like some kind of upset stomach, some kind of insomnia, lack of sleep, and usually after a week or 2 weeks it disappears.
And how long would you recommend somebody to stay on LDN even if they didn't think it was working for them?
Well, usually we would like to give it 3 months. And after 3 months, they really have to decide if they're improving or not. Unless they get some side effects that they cannot tolerate, which in a certain case happen, like sometimes they cannot really sleep, or they have like really stomach upset. Like, the stomach upset, we usually change the fillers. We give them the acidophilus, which usually is gentler on the stomach. And we do that when they have a stomach issue. Now, lack of sleep, we usually ask them to decrease the dose, start on a lower dose, and then increase it to 4.5. And but the issue is also when you start on a lower dose, you might not see the same result as you see it in a higher dose. So we try to balance it.
What instructions do you give people when they first start taking LDN?
To take it at night before they go to sleep. Do not judge it until like at least 14 days. We would like 3 months, but if you do not have the patient to wait 3 months, do not make any judgment until you take the medication for 14 days. Take it between 9 and 2. And if you have any kind of side effect, please give us a call immediately. we might be able to do something to help.
A question that I'm always being asked is, can you drink alcohol with LDN?
We do not recommend alcohol with any medication. When you are on medicine, you should never drink any kind of alcohol. I would say no.
Is there anything else that you would like to add that you think would be of benefit?
For the LDN patient, I think anybody who has an MS should give it a shot. I think it's very good medicine. We have seen in our own eyes, we have tons of patients who's taking it. The success on MS is really high. For any other purpose, I might be more hesitant to push it as hard as I push it on MS, but MS, I really think anybody who has MS should go on this medication, and they will definitely, I wouldn't say definitely, but I would say the chances are very high they will see a result.
Well, thank you very much, Victor, for sharing your experience with us.
Thank you.